on this segment, we're going to talk about the basic 2 cranial move. I'm going to show you the placement first, and then we'll have Dr. Hockman come in and we'll put our hands on him and show the movement. So the first thing is on the top hand, I'm going to put the palm of my hand over the frontal bone. And my fingers are going to wrap down 2 on each side over the nose. And I want to approximate as much as I can the malars and maxillas on each side. So this is what it's going to look like. Okay. Underneath the palm of my right hand is going to be under the occiput. My hand is going to be turned slightly sideways so that my fingers can accommodate the the occipital-parietal and temporal bone sutures as much as possible over here. And on the other side, my thumb is going to be wrapped around and try to get as much as possible with the mastoid and the suture behind it along the parietal bone, the occipital bone, and temporal bone. So this is what it's going to look like. Okay? The motion is what's going to happen is my palm of my hand is going to press slightly down with the frontal bone, and at the same time, I'm going to try to pull slightly up with my fingers with the malars. So you'll see this kind of a motion like this, a slight squeezing. So as this is coming down, as the frontal bone is being brought down this way, the malars are being gradually tractioned, very slight like this. Underneath this particular hand, the motion is going to be as they breathe in, my hand is going to try to bring the occiput bone down and up just slightly. So the motion will look very subtly like this. You want to be careful not to be doing this kind of rocking. This is not what it's about. What's going to be happening is as the patient breathes in and breathes all the way out, there's going to be shifting of the cranial bones. Each cranial bone individually, as well as the cranium as a unit, is going to be going into flexion and extension. And what we're going to be doing is stabilizing and then guiding along with that motion. So without the breathing, you're not going to get very far. You just can't push these bones around. That's not what it's about. With the breathing, internally what's going to happen is these bones are going to go into flexion, and as they breathe all the way out, into extension. The shift underneath your hands, the shifting occurring because of the breathing and the forceful pushing the cranium into flexion extension, along with your guidance, is going to be what helps release these sutures. And that's what Basic 2 is all about, is releasing the sutures, thereby also releasing the spheno-basilar joint. Okay? Oscar almost did it right there. Okay, there's Oscar. So that's what it's going to look like. Okay? If Oscar's got a really big head, you're not going to be able to do all the contacts. You do the best you can. All right. So Dr. Hockman, please come into the viewing arena. I'll be able to cut it out.
No, you know, your head is not in there. It's just your head.
Okay. Dr. Hockman wants to tell me that my head is not showing up in the film. I don't want to scare anybody anyway.
So I have to raise the headpiece.
Okay.
Big knob on this side.
All right. So now we'll put the movement into the process here. Raise your head up just slightly. There we go. Drop down. Little side comment here. This is a bit of a social comment. You'll notice that Dr. Hockman has a fairly large head here. This is because he's been doing SOT for at least 40 years, and he's starting to look like Dr. Major DeJarnette. You know, it's just uncanny how that happens. You know, big damn head. Here we go. I got my placement underneath, overhand, and there we go. Even with a big head, I can do it. So what's going to happen is, as he breathes in and toes up, his cranium goes into flexion, and I will very slightly do the motion, and then breathes out, toes all the way down. I can pull back slightly. He breathes in and out. Watch my top hand. You can see I'm relaxing. Breathing in, I'm doing the slight squeezing. Malars come up, frontal goes down, breathe out, relax. Underneath my occiput, breathing in slowly, my whole hand goes down and up, down toward his shoulders, and then up to bring the seno-basilar joint superior and anterior, and out, and relax.